Welcome back to the Quantum Couch. I'm your host, Dr. Ina Conboy. The guest on today's episode is Dr. Kathleen Friend. She's a board certified psychiatrist and a practitioner and educator of heart rhythm meditation. Her career integrates traditional medical training with the study of heart based contemplative practices. Her academic interests include the neurophysiology of emotion, heart rate variability, which is a well studied marker of nervous system flexibility and resilience, and the impact of meditative states on autonomic regulation. She explores the interface between measurable physiological coherence and subjective experiences of calm, empathy, and presence. Dr. Friend's work contributes to the growing dialogue between medicine, psychology, and contemplative neuroscience, bringing the science and wisdom of the heart into clinical and professional well-being. Dr. Friend, welcome to the Quantum Couch.
Thank you. It's really a pleasure to be here.
Um, I'm wondering if maybe we can start with you telling us a little bit more about yourself, your work, and how your journey led you to heart rhythm meditation.
Sure. So it's hard to know where to drop people into the story, but I've been a physician for like a gazillion years. And I've certainly gone through a lot of the ups and downs in career and trying to find where do I fit in and how to make this work and how to be holistic and all that, just like a lot of the people listening to your podcast. Um, but let me start the story. I met a woman who she's actually a dentist in Massachusetts when I lived in Massachusetts. And our lives intersected because we both had profoundly gifted children, actually.
Mm,
And so we kind of, our lives uh, came together in an organization, through an organization to help parents. Like, how do we deal with our kids?
mhm.
And so she was like ridiculously smart, and I could tell. And so I really trusted what she said. And she said, "Oh, I'm taking this really cool online course." That this was a time when online courses were not a thing. Okay. So this was really novel. Okay. This was about 15, 16 years ago. And, I said, "What are you doing?" She says, "I'm doing this thing called heart rhythm meditation." And I go, "What's that?" She said, "Well, go to a class and it's a way to meditate that helps you really get in touch with your heart." And I thought, well, I kind of trusted her, her judgment. So I jumped in, and it wasn't an immediate click because it was online and that was really weird. And like, it didn't feel personally connected. But then I went to one of the retreats, in person with the teachers of heart rhythm meditation. And I was in this group of people whose hearts were open, and I could feel that. And I went, "Oh, this feels yummy. I want this."
What did it feel like? What
And
was what was
oh,
different about it?
I felt like just kind of, I'm trying to go back to the words I would have used then, you know what I mean? Now I would say different things, but I just felt like at ease. I felt love. I
Mhm.
felt like I fit in, like no pressure. I didn't feel judged. I just felt kind of accepted and easy. Um, didn't have to prove anything. And so I immediately signed up for their 2-year course called, at that time, it was called the University of the Heart. And,
Ooh.
and I went like, "Oh my goodness, anything that's got a name like that," because I had wanted to be a cardiologist. I'm a psychiatrist now, but I started my life as in internal medicine, and what I was headed towards cardiology. I was at the Cleveland Clinic, for God's sake, at the mecca of cardiology.
Mhm.
And like I was headed there anyway. Life had other plans. And so this University of the Heart, I went, and this is before people were talking about heart. Everything was mindfulness, mindfulness. And I went, "Oh, I like the name of that. I'm just doing it." It changed my life.
Hmm.
Changed my life in every way. my relationships to people, my marriage. Um, I'm laughing. It did not immediately change my relationship to my son, who was starting to become he was about 15 at the time, and he was entering the snarky phase. So that took many more years to have this, what I know about the heart, which has now prevailed, by the way, and he's almost 32. But at the time, that was like, whew. But it really changed my relationship to my career. Um, and I became aware of there was a softening. I wasn't in my head like, like most doctors, like we're smart. I mean, at least we're hard, or at least we're very hardworking. I mean, maybe in my
Sure.
case, I don't even know if I'm smart, but I just know that I was disciplined and very hardworking, and had a few brain cells working, but basically really valued my brain and my mind. It's a thing that my whole life I had been complimented on. Oh, you know, Kathy's the smart one in the class, and she's the smart kid, and the whole thing. And she's going to really achieve, and yada yada yada. Well, I that was a big part of my identity, and to some extent, I was proud of it. I mean, there
Sure.
were, and there were things to be proud of about that, but I discovered that it was a very small piece of who I was. So that was the beginning of the heart rhythm meditation journey.
So, in those 2 years that you were doing this training, what did that look like? And what do you think shifted within you that allowed for so many things to expand in your life?
You know, I feel like it was almost magic, but I mean, I'm almost at a loss for words. I mean, I can certainly talk, and we will over the course of this podcast talk about what it really is, what's heart rhythm meditation. Um, but at the time, I just did the practices. It's a specific kind of meditation that really puts you in a state of coherence and very high vagal tone, which we'll
And what
talk
does that mean? Coherence, vagal
about.
tone?
Um, what that really means is it's a setting. It's getting into the part of your nervous system that um, is, some people would say it's the parasympathetic nervous system, but honestly, it's more than that. It's really getting into the part of the a vagal nerve system that relates to social connection, um, and is totally out of the fight, flight, or freeze arena,
Mhm.
and it's into the social engagement network. I mean, that would be what Stephen Porges is. Maybe we'll go into that later. Polyvagal theory, he calls it the social engagement network. And honestly, you have to be out of the stress networks to be in that other place. So I was spending much more time in that place of connection, of
Hmm.
actual connection. And it
Mm.
was through the practices which changed the energetics of the heart. And we'll talk more about that maybe down the road here. But in the program, I think I just spent more time understanding my inner landscape from the point of view of my heart. I learned that my desires were important. They weren't
Hmm.
something in the way. This wasn't like Buddhism. It wasn't like attachments and desires were a problem. It was like that was there for a reason. I don't have the same desires and wishes and all that as you or anybody else, and that's unique to me, and that's clearly important. So in a way, going through this program got me so much more in touch with my own self beyond my mind, but in a practical way, it helped me shift my perspective of other people.
Hmm.
So, like, without being too disclosing, to my husband, because, I mean, he doesn't want his story told, I'm sure, on podcast. But, I saw him in a certain way, um, and perceived certain, characteristics about him in a very negative light. I felt like he wasn't really pulling his weight. I was really had become pretty much the primary breadwinner, that which is not uncommon for female physicians. I've seen that happen a lot over
Mm,
time. Um, and anyway, I had a pretty negative, like, why isn't he coming to the table, picking up? But I had a real shift in perspective, and I don't quite know how it happened other than I know that when I'm in my heart, I'm less judgmental. It doesn't mean I'm not discerning about things.
mhm,
That's important, but I wasn't judgmental and assuming that the qualities I was seeing in this other human being were problems and needed to be fixed. And suddenly I saw who he was, like on a deeper level, like his qualities, which are phenomenal. We're still married. I think this is going to be year 42. I lose track, 41 or 42. Okay. So, yeah. And I was able to really see, if you want to say the divine within him. I mean, that those innate qualities that made him unique. His greatness, his zone of genius.
mm.
And his zone of genius had nothing to do with what I thought it should be. And I could see that through my heart. Does that
So
make
it sounds
sense?
like you just tapped into tremendous empathy in a way.
Um, that's a good maybe. I didn't perceive it that way at the time, although yes, I think it definitely did lead to greater empathy. I think what it did is like opened the perspective. Like suddenly I was seeing things like this, and now I could see a much bigger picture. And I shifted my whole without being told to do this. It wasn't like an exercise I was given, like,
Mhm.
look for the greatness. I mean, that has evolved into my work, by the way. But at that time, back then, nobody told me, "Oh, look for the positive qualities and try to pay attention to that." Nobody said that. It was a natural consequence of working with the energy in my heart and strengthening it, and suddenly the blinders came off, and I thought, "Wow, look at this person in front of me, like, he is this and that." It's like, "Oh my god," it's like I was blown away, and I
Wow.
still have that perspective, and becau when I made that shift, I don't even know if I told him exactly, but my behavior changed. Clearly, I started reacting completely different, and
In
what
what way?
oh, I wasn't critical, I wasn't, like, complaining about, "You're not doing this or that." I started noticing what he was doing and where his
Mm,
and I just naturally started being grateful. I think maybe gratitude, it
mm.
maybe even more than empathy, I think I felt a lot of gratitude. Um, and, uh, I voiced it, that I thought, "Wow, I really appreciate blah, blah, blah." And it just came naturally, and over time, and I'm saying this now 15 years, he has evolved into the best version of himself. Do I
Wow.
still complain sometimes? Oh, yeah, sure. But
You're still human.
yeah, exactly. And I catch myself, but it doesn't take away from I see how he grew into really who he was meant to be. Mm.
Wow.
And it's beautiful. And so after all these years of marriage, we are really different. We have things in common, of course, or we probably wouldn't have stayed together, but we're really different people. And like he's kind of in his lane and I'm in mine, and we kind of know what they are. And they're very complementary.
Do you feel that with his growth, he was able to see the beauty and the growth within you?
Not as much. Um, Maybe a little bit. I think he did, but not as pronounced as me because I was the one doing the practices.
Mm.
Um, I think I think he noticed it kind of unconsciously because he behaved differently to me, but I don't know that it really came to consciousness for him. But
Mm.
that was the most significant beginning thing that I got out of being in that program. There were other things, but I um it affected my work with patients.
How so?
Um, I felt it kinda took me off the pedestal, and I felt like I was just obviously, people were coming to me because I knew things they didn't know.
Mhm,
Otherwise, why come to me? Sure, but I felt like we were on a journey together. I felt like we were more like human beings journeying on a path together, and I knew some things and they knew other things, and so I felt the learning was bidirectional,
mhm,
very open to learning from my patients, and at that time, um, it was really interesting because I was one of the early adapters of, functional medicine in psychiatry. Um,
hmm,
I didn't know anybody else in psychiatry. I knew all the internists and stuff doing it. Um, but I cobbled together what I could, and I really tried to have a different kind of practice. And my patients, I told them I was just transparent. This was 15 years ago. Like, wow, I want to do things differently. Are you willing to do that? I mean, and I said, I'm not sure I know all the answers, but are you willing to go on this journey? And so many of those patients, they wanted something different.
mhm.
So they kind of trusted me and we kind of, we went together and it worked. And I felt such I felt so connected to them. Like I felt like, I mean, there would be times when I would be sitting in the room with patients and I could feel my heart expanding. I could feel the heart is an energetic organ. In fact, it produces more EMF, the good EMF.
What's EMF?
Oh, electromagnetic frequencies.
Mhm,
So the heart actually, because it's a pump, an electrical pump, it produces electricity and magnetism. You know,
mhm.
electricity and magnetism go together, as we know from basic, our college physics or high school physics. And so it's a source of a real energetic source. And when that gets stronger, you feel it in your chest. And so I think most of us have had the experience of um, when something really touches your heart, you feel like, there's kind of this expansion feel in your
Mhm,
chest. You know what I mean?
mhm.
Like maybe, cute puppies, nice beach, a baby, Hallmark card moment, like where you just it just kind of opens up, right? And you kind of feel it in your chest.
Sure.
That
Yeah.
that's the energy in the heart. And so I would be sitting with patients and sometimes I could feel that and it would just open up and it allowed me to see the patients through my heart and not just my mind. And so it did create more empathy in that situation.
That's absolutely beautiful. So I guess I'm just really now dying to know more about what it is and how do you meditate, because I personally do a lot of mindfulness meditation, and I've definitely had experiences that you're talking about where your heart expands and you feel just there is a physical sensation that happens
I
here,
know.
and it's like it is expansive and it is beautiful and it's warm and fuzzy, and there's like there is a feeling like a as f and the heart chakra, I guess, if we wanna talk about the chakra system, is very powerful, and it came into my life at various points where it was really important. But could you please tell us a bit more about the meditation process itself and what it
Yeah.
entails scientifically?
Yeah, sure. So the basic uh heart rhythm meditation um procedure, just the beginning steps are to it incorporates a couple of elements. One is a rhythmic breath. So what that means is the inhale and exhale are equal.
Hmm,
It's interesting because a lot of breath techniques that teach, how to get more parasympathetic tone are they emphasize a long exhale. But in this method, it's a rhythmic, even breath. Ideally, about 8 seconds in, 8 seconds out. heart math does 6 and 6 and, it can quibble, but the truth is that the deeper the breath is, the more energy that gets created. It's an energetic situation.
Hmm.
So, a rhythmic breath, and we learn to go inward to and it's deep, obviously to get that kind of breath, let's say 8 in, out, it's a deep breath, um, filling up your lungs. You're trying to really fill the lungs completely, a diaphragmatic, breathing kinda, and then really exhaling all of it, and which leads to a much better inhale. But anyway, I'm digressing. But basically, a very deep rhythmic breath. And the second step is you go inward and start to feel your heartbeat. You
Hmm.
sense it. Some people have to start by touching their carotid or neck or their, pulse at their wrist to feel it, or even on their chest. But what really happens is you start tuning in, you can feel your own heartbeat. For some people, that happens right away. Some people, it takes 6 months. But the idea is to then use your heartbeat as the counter.
Instead of the breath for mindfulness meditation.
Right. So you're breathing 8 heartbeats in, 8 heartbeats out.
Huh. Okay.
So it's a real deliberate coordination of these two fundamental rhythms in our body, which is breath and heartbeat.
Hmm.
And it's putting them together. And in the beginning stages, it's like mindfulness in the sense that you are very much paying attention to a heartbeat and counting. So it gives you a focus to something to focus on. So it's really at the beginning very much like a concentration exercise,
Hmm.
which mindfulness in the beginning, I can't speak to that completely, but I know at the beginning it's very much a concentration exercise, focusing your attention on your breath, trying to
Yes.
bring yourself back to that and just, kind of, be aware of the other stuff, but bring yourself back. And that's true at the beginning stages of heart rhythm meditation, but it's with this incredible coordination of heartbeat and breath. And what happens is the unconscious really, it could be challenging at the beginning because stuff comes up. And in heart rhythm meditation, we don't we don't really have the idea that, oh, we're just going to be watching a movie and watch this stuff going by. It's like, oh, this stuff's important. Like, there's a little, and the idea is to be with it and to keep the breathing and heartbeat going so that all that stuff can be digested, if you will, and integrated um, without overwhelm,
Hmm.
with being able to stay in that co- coherent state. And it gets you to stay with all that in a feeling of safety in your body. Um, so
And how long is the each session approximately? Like, what is the minimum usually? And is there a recommendation for how long one should do a session of
yeah, I'm trying
meditation?
to remember back because it's been so many years and I don't, for me, I jump into it pretty quickly now. I think at the beginning I would do like 20 minutes. Um, I think 10 or 12 minutes is kind of a minimum. But I think the more important thing than the time is a routine,
Hmm.
is having a specific, more or less specific time of day and place where you do it so that you start it. It's a little bit like, substance abuse and drug addiction. They talk about some people go into rehab and they get clean or whatever. And then they go back out and suddenly they see the cues of around them
Sure.
that were related to drug use, and like, boom, they have a relapse. Well, we want to use that same idea for meditation. We want the body and everything to start
Hmm.
saying, oh, this is my place. This is my place where I meditate, or I feel support, I feel good, or I feel like I can take a little space for myself. So you want to use it positively. So having a regular spot, having it be absolutely quiet is not really that important. I mean, people think they have to have everything just perfect. No. I mean, yeah, does it help? Sure. But if you got dogs and kids and things in your house, don't worry about it. That's all. You just you you can meditate with all that going on. You can, I mean, close the door maybe, or, but you can do it. Having a chair, so we sit up in chairs. I think a lot of people do that now. And I'm going to sit up straight now. And we really emphasize a very straight posture, and like for me, I'm pretty good at it now, but for many years I put pillows behind my back,
Mhm.
and so that I didn't have to like strain my body so I could feel at ease, but that my spine was straight. Why? Because you're moving energy in your body up and down through all those chakras. And so if your spine is straight, it's kind of like an antenna.
Mhm.
So we do emphasize something we call it the monolithic posture, but it just means sitting up straight with your spine straight. Um, and the chest is kind of open and you're not slumped over, and your feet are on the floor. So the energy can kind of move from the earth to the heavens, so to speak. Um, yeah. What else can I say about that's kind of the basic practice.
Mhm. And so this is the practice. Is there any scientific research to back up how it's working? What is it doing? You mentioned
Yeah.
vagal nerve in the beginning. A lot of people may not know what vagal nerve is when they're listening to this podcast. Can you kind of give us a little bit of just like layman terms of what all of this is about?
Okay. So, yeah, let me back up and don't let me forget to tell you there is one research study on heart rhythm meditation, but let me back up. Vagus nerve is like a ridiculously long nerve in our body that goes from the brain and wanders. It's also called the wanderer. It goes to parts of our face, our lungs, our heart, our digestive system. So it's really in a simple way, it's the parasympathetic branch of our autonomic nervous system. Our autonomic nervous system being that part of our nervous system that is, used to be thought as being not automatic, not under our control, as opposed to the part of our nervous system that like moves our arm, for example. We decide, oh, we're going to move our arm or our hand or something. And, that's more the voluntary nervous system. I don't know. I think it's called that. It's been a long time since I thought about that. But the autonomic nervous system kind of operates under the hood, under the radar a bit, but
Mhm.
it's important for everything like related even to digestion. They used to just be called rest and digest. I think our understanding has evolved from that, but back in the day, it was like you were either in fight or flight over on the sympathetic branch of the autonomic nervous system, that part that, releases adrenaline and, to get us in action, as opposed to the rest and digest part that allowed us to, um, take a break.
Mhm.
Um, and speaking of break, in some models, they talk about the vagus nerve being kind of a break on the sympathetic nervous system. And in the sympathetic, it's the one it makes our heart, blood pressure go up, our heart rate go up. I mean, this is not all negative. We would be dead without our sympathetic nervous system.
Right.
So it's really a matter of balance here. We don't want to be stuck too much in the parasympathetic nervous system. At the extremes of that, we're dissociated, and I could talk more about that. So it's this flexible balance that we're trying to learn to have between both systems, like a car. Like, when do I need to be in first or second gear for those who know maybe how to drive a stick shift, but maybe nobody knows that anymore. But, like when you're at a lower speed, you need to be in a lower gear or on a bicycle, right? Um, and then there are times when you're going up a hill and you know what? You need to be in a gear where you can like paddle faster and so we're the same way. So we're looking for this real flexible balance. And one of the ways scientifically we see that balance is in something called heart heart rate variability. And what that means simply is that as we inhale and exhale, um, our heart rate changes. The beats, like, we don't really like, we take a pulse and we say, "Okay, it's 70 beats per minute." Well, no, not really. We're not sensitive enough, like, when we take a pulse, we're not sensitive enough to feel those little differences, but on an EKG or something, you'll see it's not exact. In fact, you don't wanna be exact. If you're like a metronome, that's low heart rate variability, and that has very bad implications because it's associated with higher mortality, especially
Hmm.
as we age. It's one of the biggest predictors of mortality. So
Interesting.
yeah, so heart rate variability is these little shifts that are going on between the sympathetic and parasympathetic system, and you can measure it in this heart rate variability on, um, you know, there's different measures for it, and so heart rhythm meditation has been shown to increase heart rate variability. And for people who practice it, I'm trying to remember, maybe it was 6 weeks or 8 weeks. It was a study that was done um, at a university in Pennsylvania by some people I know. But I think they put the people through an 8-week course, and the people were only practicing, like, don't quote me, I think maybe 12 minutes a day. I mean, it wasn't ridiculous. And they found that even after doing that, even if people weren't doing it every day, that measures of heart rate variability were improved even after the course was over, not just when they were doing the meditation practice. So,
That's incredible. So, I mean, what you're saying is that essentially, please correct me if I'm misunderstanding this, is that in addition to the positive day-to-day human interaction outcomes that can come from this type of meditation, you could also get measurable physiological, I wouldn't say advances, but advantages. There we go. The
oh
word
my god, yes,
advantages.
yeah.
Yes.
And I'm
So,
yeah, I'm glad you brought that up because there is just a whole list of
what's
the
the list?
okay, I'll give you the list. Okay. So, wow, are you ready? I mean, it's like a kind of amazing. This vagus nerve is such a like how maybe you people do or don't know. In the body, there's something called glutathione, which is they call it the master detox molecule. Well, the
Hmm.
vagus nerve is sort of like the master. I don't know what the word would be. It's not detox, but master.
Regulator?
Good. I like that. Yeah, master regulator. So there are cardiovascular benefits. Um, we talked about the higher um, heart rate variability, which has been associated with longevity.
Mhm.
Well, people tend to have lower, it tends to lower their, resting heart rate, improve. There can be improved blood pressure, reduce risk of arrhythmias. Um, uh, Better recovery after stress. Um, then if we just go to the brain and cognitive function, there's improved emotional regulation, reduced anxiety, improved attention. Um, and that's really important because I work a lot with kids and you know what? You can't pay attention and learn when you're in too much overly activated on that sympathetic side, that arousal system. You need a certain amount of arousal, of course, because you'd be asleep. But you it really helps for improved learning and memory, and executive functionings. I mean, basically being up in your frontal lobe.
Hmm.
um, it's been shown to help with PTSD, depression, increased sense of safety, groundedness, greater capacity for joy and connection, Then there's its effect on digestion and gut health. So there's improved, um, uh, like our enzymes, gastric acid secretion, enzyme release, gut motility, nutrient absorption. Um, I mean, that's all really important.
And is this research? Like, are these the things that are products of research?
The short answer is yes. And immune regulation,
Mhm.
it also it activates the, anti-inflammation pathway with reduced inflammatory markers. Um,
There
what
so
else?
obviously there's a lot. Have you seen any of this in practice? Like, do you teach this to your patients? You work a lot with kids. Like, is this something you have seen not just on yourself, but on others?
What I mostly have seen in others, since I'm a psychiatrist, mostly what I've seen in others are the, cognitive and emotional benefits,
Mhm.
because I'm usually not measuring inflammatory markers, although that's
Sure.
starting to change. I'm actually starting to do stuff like that. But historically, it's been more evident in stress resilience, a sense of well-being, greater satisfaction with life, better capacity to handle overwhelm because we live in an incredibly overwhelming world. I mean, well, especially today. I mean, we're all drowning in, first of all, total information overload. I mean, like we can't get away from anything. And it's overwhelming. I mean, there's a lot of stuff being thrown at all of us. I will say that when you are grounded and have learned how to increase that energy in your heart, that's a big, longer discussion, but there's very specific practices for that actually, that even beyond the basics I told you. But the more you have that energy in your heart grounded and strong, the better you are able to um, not get tipped over with all the information coming in. And, we all have our limits, and I wouldn't say, well, let's give ourselves a steady diet of all the negativity, but it allows you to be present with a lot of what's going on without having to really retreat from it. Being able to stay present with more of it, up to a limit. We all have our limits, but
You've mentioned in the beginning that when you were learning to do this, your son was just turning basically in the middle of being in his teenage years, and now he's in his 30s, and that somehow it did catch up in your relationship with him too. How did it impact your relationship with your son, if you're willing to talk about it a bit without going too much into his personal life? But how did that contribute to your parenting?
yeah, that's a great topic. In fact, so yeah, that's a good topic because of the challenges that I dealt with my son, which, looking back, are pretty much normal developmental stuff. The kid wasn't really off the rails. I mean, I didn't have real serious problems, but it was more of an attitude and difficulty in him really trying to push away strongly from me and reject it, really, really strongly, and being very critical of me. Um, and which was hard for me to understand because here I had this really open heart and I was appreciating all his greatness and all this. And initially, and I still do this, a lot of my work with children has really been focused on seeing the strengths in children. And I wrote 3 books about this, actually.
Oh, wow.
2 children's books and 1 for parents and teachers, all about, how to use heart rhythm meditation and to start to see the greatness in our children and, where's their zone of genius. A little bit like what I described about with my husband, how that process happened. So how to move them along in that direction in their relationships with their children. So my son really rejected that. So I was doing that with him too. Like I would always be pointing out his great qualities and da da da. And he really he pushed back on that. He did
In
not.
what way? Like, what would he say, for
Oh my
example?
gosh, it was like don't don't practice your stuff on me.
Hmm.
It became a thing, like, he kind of felt like I was being his doctor or a
Hmm.
therapist, or, you know, like, he wanted me just to be mom. He didn't want me to practice any of my skills and things I did in my work on him, because he felt like
Hmm.
I was trying to be a doctor, you know?
This all sounds like it was a power struggle.
Oh, yeah. Big time, big
Hmm.
time. And, oh, thank goodness, what a powerful human being he is, and thank goodness he fought back against me, because I learned so much. In fact, now I'm starting to develop programs to help people, grandparents and adults with their adult children. I'm kind of moving in that direction because I've walked through this path. So what it did is, so that initial impetus that I still teach to a lot of parents with younger children about seeing the greatness and all that. But for the older children, and this is where my son comes in, I needed to do something different. I mean, of course, staying in my heart helped me steady myself and not be so triggered by his criticisms. Let's start
Hmm.
there. So initially, you know, when he would be critical in this, I go, oh no, that wasn't my intention. Like, I really no, I see you as an adult. I don't see you as a little kid for me to be the, like, I'm all for you. Like, no, no, didn't work. He didn't want to know anything about my intentions. It was like he just wanted to be heard. It took me a while to get this. That honestly, and he led me. He was such a good teacher. He led me to, like, oh, no, don't fix me. Don't do anything. Don't give me any of your great ideas. Like, just be with me. Hear me. This is my reality.
Hmm.
This is my subjective reality. You know, things I would do normally with patients, right? But this was my son, so it's
Sure.
different. Like, just hear me. And he wanted to feel safe. This is the irony, is he started saying, "I don't feel safe around you." And here I'm like the master of working safety in the nervous system, right? And so the universe in its infinite wisdom gives me a child who's saying, "I don't feel safe with you." Right? He does, I would say he does 90% now. I think things die hard, but I think we're about 90% of the way there. I had to get out of the way. I had to just not get triggered. Well, I don't want to say not get triggered, because we get triggered, but
Sure.
not to act on that, to be able to reset myself into this coherent state so that I could take in what he had to say and stay grounded and really see it from his perspective. Um, and to, um, so that, I think that was the big thing, and to communicate to him. At one point, I remember saying specifically, uh, why don't you just tell me if you want me to show up like a mom or just a fellow human being on the journey with you? And that sentence seemed to go a long way. He really liked that. He'd go, okay. So, just so you know, I'm still available in that other role. But now it's more like, now many more years have gone on, and it's really, boy, is it a developmental phase to go from the caretaker role as a mother or father.
Hmm.
You know, we're supposed to, I mean, we have obligations to go from that caretaking role to the more collaborative, a collaborator. And that's a developmental journey.
For who? For both? Everyone involved in the journey?
Involved, but especially the parent.
I can only imagine. I'm not there yet. And I'm listening to your story and I'm like, oh my goodness, this is probably going to be me. Because I in some ways, as you're telling me how you parent, I can see myself parenting very similarly. And I can also imagine how it could definitely backfire.
Yeah, that was big time attachment parenting. The kid was in our bed till he was
Yes.
12. I mean, I was like all in. My heart opened so much when I had this child. Like, it was like, boom. It was like, whoa, hormone city took over and got me that way. I didn't even know I was going to be like that, but it just did for me. And so I've had to really walk this journey, how to stay attached in that deep feeling. I'm grounded in deep love in my heart, and I still feel all those feelings as a mother.
Mhm.
But how do I show up like that in a way that's appropriate now? And I have to say, my heart breaks when I hear all these children. No, they're not children. They're usually you know, young adults, going no contact with their parents. And so it just breaks my heart. So I think that's why I'm going to start to give some workshops and classes to try to help people. You really have to change your expectations and your stance, but you need the skill to stay grounded in that social. I'll go back to the social connection part of our nervous system, which is when we're in that high vagal tone, we can connect. Otherwise, we don't really. We might think we are, but we're kind of in fight, flight, or freeze, or fawning, and all that.
There's a lot to digest there.
Yeah,
Um,
I know.
so
Well,
you mentioned that you wrote a few books. Can you tell us a little bit about the books and
mhm,
what are they called? Where can we find them? And also obviously, what are they about?
sure. The first book I wrote is called The Greatness Chair. And it's a children's book, and, it was written with the character is, like, kinda like early elementary school age, but I found that actually this book has helped teenagers too, and preschoolers, because the pictures kinda tell the story, and it's a story that evolved out of my practice where one day I was seeing family after family with kids, and I started feeling like the parents were coming in and telling me all the bad things about their kids. And of course, they had problems. They wanted me to help them fix it. I get it. But I felt terrible. I was like, I can't hear this anymore. Like the kids wouldn't want to be in the room. They would just
Hmm.
sort of be, kind of slumped down in the chair and all the body language of shame or maybe they'd be off playing with the toys in the corner and they would just avoid it. They didn't want to be in this conversation at all. And one day I just couldn't stand it. So I said to a child, I said, "Come over and sit next to me, the chair next to my desk." And fortunately, the child did it. And I said, "Oh my goodness, thank you. How did you know? You just came over and sat in my greatness chair." And the child, first of all, I hijacked their brain with that. Whatever they were thinking, like I kind of hijacked them. And I went, "You know what we do in this chair?" And the child's going like, I don't know. And I said, "Oh, this is where we talk about our greatness. Tell me about your greatness." And my kids would usually kind of go, "I don't know, like what?" And they went and said, "Well, I got an A on a test." Or I go, "Oh, wow. Well, tell me more about like what about you that enabled you to do that?" I did it in kid language. Anyway,
Mhm.
that was the start of the greatness chair. And what would happen is the parents in the room would relax when I did that. And suddenly I could see the spark going off in the parent, like, oh my god, they couldn't wait to jump in and tell me about the good
Oh,
things about their kid. They
so
were
beautiful.
chomping at the bit over there to tell me. And I thought to myself, "Oh, that makes sense. What parent doesn't wanna, like, share the good things? Like, who wants to really come in and talk about, 'Oh, my kid is this or that?'" And I realized, like, how important that was. And after we did that activity, when we moved to trying to address whatever problem brought them in, everybody felt relaxed and safe and connected. And so then we were able to tackle, the problem. So that was the beginning, and then I wrote The Greatness Chair, a story. And
I
it's
love
it's a
that.
little bit parent education in disguise that the child, um, you know, me, my alter ego in the book, comes and shows the child how to see what's going right, even in behaviors like that look like they're going wrong, and then they
Mhm.
teach the parent. And so that was the first book. The second one is Sarah in the Greatness Chair. It's a girl, and it kind of takes the techniques a little further. And then I wrote the Greatness Chair Solution for parents and teachers. And that's the one where I teach some of these self regulation skills through heart rhythm meditation
Mhm.
and strength-based psychology to start seeing their child through a different lens and tapping into their own values as a family. Not society's value, but who are they? What's important to them as a family? And go for that. So all those books are on Amazon. Um, and Greatness Chair. If you put in Greatness Chair, a
That will
picture of a
come up.
chair will
By
probably come
Kathleen
up.
Friend.
Yeah, yeah.
Mhm.
But those are the books, and um, that's been really impactful for a lot of people.
I really love this. The way you're talking about this, and hopefully for people who are listening, who are watching, there's like a feel about you throughout. Like it's a very kind and warm and open-hearted feel, and it's even coming through the screen.
Ugh.
So, I mean, is this something that you think you've always had, and so you were kind of more drawn to this type of meditation because of that, or do you think that kind of came out more because of the meditation?
That's a really good question. I think that deep down, yes, I think I was like this a long time ago as a child. But I gravitated very far away from my basic nature, through all my education and medical school, and I wasn't so nice. No, I wasn't so open-hearted. I was the smart kid, and I was gonna kinda let you know. I mean, I wasn't shy about, like, expressing my opinion I mean, I was always pretty diplomatic, actually. I was never unkind, but I didn't mince my words, and I was
Mhm.
because I always was I thought it was important. I had this very naive idea that, well, everybody wants the best and this and like, well, no, it's more complicated, but, so no. In fact, in my residency in psychiatry, I'll never forget this. I was in a program where we were still being taught by psychoanalysts in New York City.
Mhm.
Okay. God bless 'em. Oh my goodness. When I look back and think about the humanity, whether you believe in the procedure or the technique of psychoanalysis, doesn't matter. These old time psychoanalysts were so connected to humanity and a wide view. Anyway, so one of these older gentlemen, we were walking down the hall and he looked at me and he said something to the effect of, you know, be kind. Everybody's carrying a burden. Those weren't his words, but basically it was communicating to me like, like, be kinder, be more compassionate about what you see because life is hard for everyone. And I don't think I knew what to do with that, but he made his imprint on me like, oh, oh, I'm not being like, I'm being too judgmental. I am not being
Mm,
kind enough, all the things. So then when I think that I became a natural for the heart rhythm meditation, partly because my heart really opened up after I had a child. That
mhm.
put me on the path. That got me out of my head and into my heart. And I think it brought me back to what I was more like as a kid. And then, yeah.
You mentioned that your son is gifted, and so
Mm.
as far as we know about giftedness, there are own challenges of raising a gifted kid. Um, Probably one of those challenges was his teenage years that came along. Um, but have you um, have you considered your own giftedness? I mean, you said that in the beginning that you think you're kind of smart, but you're hardworking, which I also see in a lot of women who are gifted. Like they think their child just comes out of thin air who's gifted, but it's not from them. So, do you feel like, have you considered your giftedness
Mm.
and how does what you just talked about is part of that at all?
Well, I have to say that when I found out, and no, initially, no. I just thought I was a very hard worker. I mean, I
Mhm,
knew that I was, kinda smart, like, I wasn't shabby, but I never thought about giftedness, and I didn't think I was particularly gifted. I thought I was, had okay smarts and just a hard worker. Um, but then with my son And when I got into the profoundly gifted world and other parents and seeing my son, I realized that first of all, I did realize that I was not where he was. I don't think I am profoundly gifted by
In
that.
what way? Like, are you able to share in what way he's profoundly gifted?
Oof. Oh, the way he can take in information and process it and just I mean, he's brilliant. I mean, like, even on social emotional things, like, you wouldn't expect that from that, but I've learned from him in that social emotional realm. Like, he's
Mhm,
an astute, observer of not only just information, but people, and he can extract so much from what he sees and learn so quickly. I mean, it's hard to put into words, but he's just so quick on the uptake. Oh my goodness. But here's the thing I realized, even though I did not feel I was at his level, and I don't say this to be humble. I think it's probably
mhm,
really true,
mhm,
but I wasn't so far away that I couldn't more or less keep, and I was close enough that I could be a really good parent to a
mhm.
child like that. And my husband is also, real smart. Um, and so we were close enough. um, and I came from a pretty smart family now looking back. And so I didn't think anything of it. I thought, well, everyone's like this, right? This is the water we swim in. But my son was a little bit higher level. And so I suddenly became aware that, oh, well, I guess I am gifted. Surprise, surprise. Um, and my husband he actually helped me understand more about myself, being a mirror for me. And he said that I'm a visionary and that he said, I've never met anybody whose mind works like you. I go, well, what do you mean? Like, oh, well. I was like, is that bad? And he said, well, no, it's just the way you put things together. Like,
Mhm.
you are the person there's 20 dots out there and you connect all 20 dots. And I go, oh, yeah, I am kinda like that. Maybe that's a little ADHD. Um, so I think that I've learned to understand my own little zone of genius,
Mhm.
um, and it may not even show up on an IQ test, but my own little zone of genius is I'm always looking for how can we do better? And I'm creative, and I'm willing to take from here and there and synthesize things across fields. And I think that's fun.
That's so beautiful and fun, and yeah, I love also how your husband can be that mirror for you, that he can see you. I mean, you're saying that perhaps you see him in because of your heart meditation, for the person that he is and the beauty that he has, but it does also sound like he does see you.
I actually think he's been affected by all the heart rhythm meditation work I've done. I think that he's gotten some of it by osmosis. There's something about that energy and
Sure.
atmosphere that I create through my heart. I think something got downloaded into him and he didn't even have to do the work.
Maybe you guys are just brain syncing, heart syncing. You're just syncing together.
Oh, yeah, and that's a great point because heart math, which has done a lot of the basic science on heart rate variability and vagal tone, they showed in experiments that, like, even if you just put 2 people next to each other, their hearts tend to synchronize,
Mhm.
you know? And then they've done other things where they showed that the heart registers information before the mind gets it.
Right.
There's
Yep.
things like that. So I do think that something happened there. And I'm really appreciative that he's been able to reflect that back to me because it's encouraged me to just appreciate what I do bring to the table and not worry so much about what I don't bring to the table. Um, and
In a way
really,
that you were doing that for him.
yeah, I guess so. So, yeah, good. You're good. Oh my goodness.
So How could our listeners and viewers learn a bit more about you, especially since you're planning on creating these workshops and classes, which I think a lot of us will definitely want to look into? How can we find you?
Well, I think the easiest way to find me is to go to my website. And even though my website only talks about work with children, there's a contact button with my email, and you can get to me.
What is your website address?
Yeah, fortunately, it's long. It's Integrative Psychiatry of the Rockies. It's
Ooh,
easier to say than to write it all out. Integrative Psychiatry of the Rockies. And that's my practice up in Boulder, Colorado when I'm up there. And otherwise, I'm telemedicine. That's the easiest way these days to get to me. And um, honestly, if there's interest, I'm always happy to put together online programs to put people through, basic training in heart rhythm meditation or parent coaching. I don't have that all up on my website built out completely, but I'm available for that. And also, like I say, I am developing this whole thing now for parents of adult children or grandparents
that's
because
amazing.
it's a thing. Oh, I forgot to mention. The other thing is the universal. This is pretty universal. Almost all of us who have adult children have learned you cannot give them advice because it is perceived as criticism. Took me a while to wrap my head around that. Well, why in the world would you see it as criticism? But they do. It's like, okay. So there's ways around that. But you really got to get into their heads and hearts.
Oh my
um,
goodness. And I'm thinking like the younger years are hard, but everything I'm hearing, it's going to be probably quite a journey when my kids are going to be older.
don't be afraid of it. I think that I wish somebody had told me some of this and that I could have understood some of this when I was going through this, but I didn't feel there was a pathway. Nobody told me any like how to negotiate this. And I was still behaving towards him like he was a young child. Like all the good parenting. I feel like
Mhm.
I was a pretty good parent and I thought I was just doing the same old stuff. Well, that's not appropriate at some point. I mean, it's you don't throw it all out, but it's you gotta just as you don't parent a 2-year-old like a 7-year-old. I mean, so the joke as a parent is like once you figure it out, they change. You know what I mean?
So
Whatever,
true. That's so true.
right? Whatever developmental stage like they're going through, and then you finally wrap yourself around it, like, oh, I kind of get it. They're kind of going through this, and like you kind of figure it out. Boom, they're on to the next one. Well, the good news is when they get to be adults, the change isn't so rapid. They kind of make one big change, and like I think you're kind of in for the long haul at that point. It doesn't change every 6 months, but there is another developmental stage, and I don't know if people really talk about that for I haven't looked at the research, and I
No,
don't
I
even.
think you're absolutely right. I don't think we do talk about it. It's as if like once the person grows up, it's like, okay, our parenting is done, but it's really not.
Oh
And
my
I
goodness,
still depend on my parents, even though it's a very different way of how I depend on them and I look up to them, but it's so there. And especially when I had my own children and my parents became grandparents, that was the next developmental step.
yes,
And then how does the whole dynamic changes of how we relate to each other?
right.
It's a never ending process.
How did the boundaries work? How do the expectations, the advice giving? It's a thing, but that's okay, and it's really doable. And I really do want to see families stay together.
I really love that.
Hmm.
Um, so by the way, you said that you mentioned that you do telemedicine in Colorado. Is it just Colorado or do you telemedicine
I do
you do
telemed
telemedicine to other states too?
Yeah, Arizona and Colorado.
Okay.
And when I'm in Colorado, I have the capacity for in person, which I prefer because I'm a people person. But I'm basically licensed in Arizona and Colorado. I'm considering reactivating New York, but I'm still thinking about that.
Hmm. Are you ready for lightning round questions?
Yes.
All right. They're going to be a little bit different. And I actually came up with them as we were talking to kind of relate more to what you were discussing. But question number one, what is your favorite question to ask a kid?
Tell me about your greatness.
Do you have like an answer you remember that you got that was surprising or some kind of an answer that still stands out to you?
I think what I remember more than the words is what happens to the child energetically and the smile.
Hmm.
Sometimes they don't know what to say, you know what I mean? I don't really I mean, in some ways I care about the words, but it's more important for the parents to hear. I like to feel like what happens, I can feel it in their bodies, everything relaxes, and they're given permission to see something of a strength. And sometimes I change the word. They don't know greatness. I have to then change the word. But that's my favorite question. Like, tell me what's going right. Tell me all the best things about you. That's my
Hmm.
favorite question.
I mean, it sounds like the question itself is probably more important than the answer, just the question that opens the possibilities up.
Absolutely. It shifts the focus.
Yeah. All right. Question number two. What's one of the favorite things to do to practice kindness? What would you recommend for others? What do you do?
Get out of your head and more into your heart. Find a way to um, center your energy and attention there before responding. And like I say,
Hmm.
a lot of people will say that, but there is a little bit of a skill set to do that. It's easier said than done, but to be kind, I would say pause. Pause. Just put your attention in the center of your chest, if nothing else. Take a couple of even shallow breaths and just bring some awareness or energy into the heart briefly, in whatever way you can. And then just s- see what comes out. Sometimes the kindness can be doing nothing
Wow. Okay.
and not
That in itself is profound. Sometimes kindness is doing nothing. Do you have an example of that?
Mm, yeah. Being there with your atmosphere from your heart, your energy, because that actually communicates to the other person more strongly than your words, usually. Words are important, but if the words come from the heart, they're stronger. But people can feel, what was it? Maya Angelou said, people don't remember the words. You say they remember how you made them feel.
Hmm.
You know? So it's kind of in that territory. So sometimes the kindness is reorient yourself into your own heart. And then whatever comes out, and it might be an action or it might be nothing. It might just simply being calm, settled in your own being. So the other person they will sense that unconsciously, they may not have words for it, but they will feel it. People read our energy.
Certainly. All the time. Absolutely. Question number three. It's 100 years from now. What do you envision is going on? What do you see 100 years from now?
Oh, goodness. I'm not that good. Oh, but I could just say what I'd like to see. I'd like to see as a humanity that we learn to um, really connect as a human family. I mean, we don't. I'm not saying. What I would like to see is that people are valued for their uniqueness. And who their uniqueness or their own zone of genius or greatness, and let that come forth and let that be okay. Not only okay, but supported, because think of it like an orchestra, like what if you had an orchestra of all clarinets, like, well, okay, but when you have the strings and the brass and everything, it's infinitely more interesting, right? The textures, the dynamics, the tones, we want that tapestry. And I would like to see um, some change in that direction where we understand that we need that. We need that contribution from each human. And I hope that humans become aware that their own individual life actually makes a difference and matters. It's important. It- they may not think it, but they're kind of here for a reason.
Mm.
And that does connect to their own individuality. So,
Dr. Friend, thank you so much for being here. It's really truly been a pleasure speaking with you. I've never practiced the heart rhythm meditation, but I do feel at the end of this talk just like this fuzziness in my heart too. Like you truly embody what you're talking about. You're not just saying things, like you are the everything what you're saying, and it's very palpable. Um so thank you very much, and best of wishes going forward with everything that you're doing to further educate us and especially the parents, which I really think need going forward.
oh my goodness, thank you so much. It's been a pleasure talking to you too.
Thank you for tuning in and listening. If you enjoyed this episode, please subscribe, leave a review, and share the Quantum Couch with someone you think might love this space too. If you would like to reach out, you can email me at thequantumcouch@gmail.com. You can also follow me on Instagram and Facebook. Just search for The Quantum Couch. Thank you for listening. Until next time, I'm Dr. Ina Conboy. Take good care, stay curious, and keep exploring. The information in this podcast is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Listening to this podcast does not create a physician-patient relationship with Dr. Ina Conboy or any guest on this podcast. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast.